Good day, everyone. My name is Nalugo Sharifa. I am from Uganda and from Joint Clinical Research Center. I'm a peer supporter and I'm being supported by partner to do this presentation. COVID-19 lockdown has made it difficult to access critical health services like psychosocial support, and with lockdown have restricted transport, interrupted treatment, and of course distress on household. With many facing a lot of challenges, this has left the normal support of services that we've been giving unattended to. This has left young mothers and, pregnant adolescents at most risk. And within the group that I support, there has been so much distress, anxiety, and psychological torture created from the COVID-19 situation. Many have not been able to get health services that they need or their babies, and they have interacted their ARVs, creating increased risk for mother to child transmission. I am now going to tell you about a program we've been able to use called ABCD. As a peer support, I work hard on trying to make sure that my peers, especially young mothers, are supported, and I provide them with ABCD of thinking healthy. I'm going to share how the ABCD pilot project and the tools I got there helped me provide support to my young mothers. So ABCD is a mobile app that provides package of care to pregnant adolescents living with HIV in form of support groups. It is implemented by facility-based peer supporters. This is normally done in small groups, but during COVID, we are not able to do so as we regularly done. And then we use the app and its tools to provide telephonic support to individual moms when we are not able to meet or come together. The ABCD tool provides me as a peer supporter with tools on my phone that helps me address the mental health needs of young mothers living with HIV in 4 ways. Number one is ask the A. This helps me ask a set of questions and to check into access on how our young mom is doing and what her psychosocial needs are. Number two is B. This tool gives me 8 structured content sessions which I use to boost or help the young mothers to think things in a more positive way. We call it thinking healthy or happy thoughts. And this is based on a WHO thinking. Then number 3 is C. C is for connect. An important part of the conversation as a group or with an individual is making sure that the young mother is linked to another support where there is need. It can be an NGO, a clinic, or the PATA support team to help and provide support for her and her baby. D is for discuss, which is the last one. I can interact and chat with other peer supporters through the app, tell them what's happening and how I found the session. So now I'm going to tell you about how ABCD works. ABCD is a mobile app and uses a smartphone. I can log in using my own peer support code, and the ABCD provides me with a structured curriculum for me to follow within the groups that I can also use with individuals. Each session has different focus and provides key questions, things to think, talk about, exercise, and things to practice even for the next session. After each session, I can record a few things in the app. I can do all this offline, and when I do get internet, the information is sent back automatically to the PATA support team. Here you can see ABCD in action. Some of the most important things in the ABCDs that I've most enjoyed is that as peer supporters are a center of everything. We were part of developing the content and testing the app. We're also able to change some things in the final version. It is a tool for me, the peer supporter. It helps me do my work and has made me more confident and helped me prepare for every session or every group sessions and individual ones. I work very closely with the clinic staff and they support me along the way, especially when I think there is a problem that is too much for me to manage or handle. We will also get to share information with other peer supporters that are in other countries, and sometimes you get to meet at the PATA Youth Summit, certainly not this year because of COVID situation. This gives you an idea of all the areas we cover in our sessions. You can see this focuses mostly on psychological well-being of a mother and how she can learn and cope better with the change of becoming a mother during her teenage years. This is more of trying to focus, it tries to focus on positive thinking and trying to shift the negative thoughts to happier ones. It also focuses on building support and resilience. Who can take part in ABCD? ABCD, if you are a young mother, 18 to 24 years, you are accepted to participate in the ABCD, and mothers of that category, we were enrolled in the ABCD pilot, and we are hoping that in the nearby future we could enroll much young mothers, because we've had cases of 15-year-old, 14-year-old coming to the clinic and wanting to take part in ABCD, but because of their age, they could not be allowed in the pilot. There is also not enough being done for this group of young mothers, and they are often forced to attend antenatal care or transition to adult services when they are pregnant. This is very hard for a young mother who sometimes rather not return to the clinic because they fear being scolded or the committee members looking at them. As we are doing a pilot study, 183 young mothers participated in Thinking Health program, and they were enrolled in the ABCD Thinking Health program. Approximately 52 sessions were conducted across 4 countries, that is Uganda, Zambia, Malawi, and Tanzania. And we started in March last year. And severe cases in Uganda and Zambia were picked up through the ABCD program, and young mothers were referred to professional care. Feedback on ABCD has been so positive and has been helpful to me as a peer supporter, making my engagement more, interactive and direct with the young mothers. So now I'm going to tell you how we were able to use ABCD to provide psychosocial support to the young mothers during COVID-19 period or lockdown. Even though we could not run the normal ABCD groups in COVID, we could use all the information and the tool to support as normal, either meeting through groups or in video, text, and chat. We'd still go through exercises, even if on phone. I could send information and educate young mothers on and correct the misconception they had around COVID-19. I could still link young mothers to health providers if we felt there was, a serious problem. And most importantly, we could, check in and encourage and support, the young mothers every day that went on. Now I'm going to tell you about the challenges that we faced as I was implementing, this ABCD during lockdown or COVID-19 lockdown. There were so many challenges since we had to adopt to digital or virtual that we weren't even used to doing. And to many young mothers who didn't even have the phone or were not accessible, like, near where I stay, we could not be able to continue having the talks. But those that had the phone and I could reach, internet, data and airtime were a challenge. And even sometimes privacy in one's homes to be able to talk affects the ability for the young mothers to continue sessions, and we had to be flexible, and I was able to support as when most convenient. I noticed that isolation, stigma, and silence cause mental health problems. And with the ability to connect remotely is so important. Physical contact, even if at a safe distance, is important as well. Sometimes the cases needed more professional support, and I was able to reach out to the clinic supervisor or PATA staff support for guidance. And just to say, I think in the nearby future, if we could adopt this tool more, it could also be shared with mothers and use it directly. There is lots of opportunities with ABCD. We used it, in lockdown, and we were even teaching young mothers on skills in that could help them, make a living since they were all, not going to their workplaces, and they had to get money to feed their babies on a daily basis. So we managed to train them and in 2 paper bags, and then to some that could reach where I was staying, I trained them into making a face mask uh, at my fashion house that I found it. So they could come and learn how to make them and sell them, and they could get, what to eat for them and their babies. As I conclude, I just want to say a thank you to Team Bata, the staff of JCRC, and to all my fellow peer supporters that have supported me during COVID-19, to all the people that I've gone to and you've helped. Thank you so much. Keep up the great work.